Hey everyone, we're live, and I'm here today with my partner, Tracy, and our guest, Jen Horonjeff. Sorry about that, guys. I'm really pleased that Jen was able to join us today. And as you all know, we're always here to bring to you every new innovation that there happens to be in terms of patient advocacy and what's available for us as patients and as caregivers when it comes to our healthcare. So I'm just going to jump right in with a little introduction of Jen. She's a patient advocate. She's also the founder of the Savvy Cooperative, and that co-op is member owned, and we're going to hear about that and what that all means. And it provides a marketplace of diverse patient and caregiver insights that's helping companies provide more inclusive health innovations, and that's always a good thing. So they really strive to give patients and caregivers a platform to share their experiences, our expertise really, as being right on the front lines of this is happening to us, and we're a big part of what is happening to us. And they believe that the future of healthcare is co-designed with patients and caregivers. So welcome, Jen.
Hi there. Thank you so much for having me. I'm very much looking forward to our conversation today.
So I'm going to just jump in here with our first question, which is, what is Savvy? What is the Savvy Cooperative? What's your purpose? Tell us how it works and kind of what led you to start the co-op.
Sure. So maybe I'll start with my personal story, which will help give some context for what we do and why we do it. So I identify first and foremost as a patient. I was diagnosed as an infant with multiple autoimmune conditions. I had a brain tumor as an adult. So I have certainly experienced healthcare through that lens my entire life. So professionally, prior to starting Savvy Cooperative, I became a human factors engineer and human-centered designer. What that means is, how can we make the world fit people who maybe have different mobility or different vision or hearing or things that, maybe might not be the same as the general population. As somebody who grew up with juvenile idiopathic arthritis, I often struggled to interact with the environment around me. So that was what I was kind of looking at. I then went on to become an academic that was studying essentially what matters to patients and how can we make sure that we include that in healthcare. And through that, then I became an FDA advisor. So I just was kind of sitting in a lot of different places in the ecosystem. And most importantly, too, I was very much involved in patient advocacy and working with my patient community. And that was really the moment when my professional colleagues started to ask me more to weigh in with the patient perspective, which is great, right? But when they kept coming back to me, it really signaled more of a diversity issue that, I'm white with a PhD and live in New York City, and I can't speak on behalf of everybody with my condition. I have no idea. And so I started just playing matchmaker organically when I would get these requests. I'd say, okay, if you want to talk to somebody with XYZ, experiences, let's go find them. And so I started to do that kind of work. And that was sort of the aha moment for Savvy Cooperative. And my co-founder, Ronnie Sharp, has cystic fibrosis and was doing similar work in his community in sort of liaising between those professionals that wanted to understand the cystic fibrosis experience. And he started doing that. So we said, why don't we create a place that's disease agnostic that helps to create best practices for how those companies or innovators or researchers could reach out and connect with patients or caregivers. And through that, now we have a better system for how we can not only reach patients, but also make sure that they are fairly valued when they contribute to these different types of projects that we offer.
Mm-hmm. So you mean get paid for their...
I sure do mean get paid. Yeah. I mean, your insights have value. And so, I understand that many of us who do this work because we want to help, there is that level of altruism about it, but it doesn't take away the value that it has. Right. And so that's what we really advocate, that people are compensated. And then at Savvy, we actually have a mechanism that when you are paid, you have the option to even donate it to a charity of your choice. I don't care what you do with it, but you earned it. And so you deserve to be compensated.
Mm-hmm. Absolutely. So can you tell us a little bit more about the mechanics of how would somebody become a member, or how does it work?
Yeah, absolutely. So you can go onto our website, which is savvy.coop. I do feel the need to spell it because I did not know at the time of starting Savvy that people would commonly misspell it. So it is savvy.coop. Savvy.coop is the website. And there's an opportunity just to say, I want to share my insights. And that's where then you can go and, share a little bit of your contact information with us. And then ultimately you will then receive our weekly newsletter. Every Monday, we share out these new opportunities. And it might be something that's disease specific, looking for people with MS to share their experiences in an hour-long interview. It might be something of looking for anybody with chronic illness who has 2 or more patient portals to test out a new app that's pulling them all together. So any number of things. And it's kind of like a little job feed that you can see all of these different opportunities. Click in to say, yeah, I want to do that patient portal user testing. And it'll also say how much you get paid. So, it might be $100 for an hour-long interview. And so you would apply. We still need to make sure that the right people are sharing their experiences based on certain criteria, but also making sure that we also have a representative group of people sharing. And so that's what we do. If you qualify, you'll be notified and matched up with that company, and off you go. And then you get paid out lickety split once you finish.
It's a novel concept. I love it. Tell me a little bit about the hashtag Ask Patients.
Yeah. So, and I don't know if you can see it in view and how we're, being broadcast right now, but there also happens to be a sign behind me that says Ask Patients, which is my subliminal messaging to anybody I talk to, because we believe this is so important. Right. I mean, Savvy Cooperative is, a place for everybody to be able to share their experiences. But yes, we are very healthcare focused. And so therefore we want to really kind of broadcast that asking patients is really what was kind of lacking from the innovation process.
Yes.
And that goes back to my personal story, right? Like all of my colleagues being like, oh, well, patients want blah, blah, blah. And I got to say, every time I am at a conference and I just hear people waxing about, oh yeah, patients want this. And I'm like, oh, but have you asked them? Because right. Those of us that are patients or caregivers, our experiences may tell us otherwise. And that's what even the kind of academic research that I did back in the day was really looking at the different priorities of people like providers, doctors, payers or insurance companies, patients, and then also caregivers. Those are two different perspectives, and they are both super valuable. So we just need to make sure that we are not projecting our own thoughts and ideas onto a stakeholder group that we don't belong to. And that's what in healthcare, it's been very paternalistic. Back in the day, it was always doctor knows best and, do what they say. And truly, some people want to do that. So I don't want to say that that's inappropriate. But now there's, more patients are becoming more empowered to be a more direct part of their care team, making decisions collectively. And so we just want to make sure that people know whether it's one-on-one, making your own care decisions, or creating the next new blockbuster drug or the next app that's going to, revolutionize healthcare. Right. We want patients to be involved in that conversation.
Well, here's why patients need to be involved. And I think this gets lost in the discussion. We're looking at, if we take a look at the healthcare tools that are being created right now, it's a lot about efficiencies. And it's coming, and there's nothing wrong with that. If we can create efficiencies and that helps hospitals and providers provide better service for less costs, then that's great. But like any good product, it doesn't matter whether it's a healthcare product or, the next food product. We have to have a conversation and an understanding of what the ultimate end user is going to be doing. That's just good business practice. Yeah. The other part of this that we also forget is somebody who has chronic issues. We know you're dealing with multiple doctors. The doctors do not speak to each other. The health systems don't speak to each other. So you or somebody in your care circle is the person who's managing all this information. We forget about that, even though the physician is, driving how you're being treated. they don't have the full picture. So I think that that's part of this issue. So, I think your conversation about the inclusiveness and inclusion in health innovation. Tell us a little bit more about that and what it means to patients, because you may, as you pointed out, you have a chronic issue yourself, but the person next to you may not look like you, may not live in the same geographic area. You share some of the same things, but there's other pieces that are not the same.
Absolutely. And I think that that's what brings it back to even what you were just talking about too. If we don't take into account these different circumstances, be it, access to care, socioeconomic status, cultural sensitivities, all of these different things, then how can somebody actually follow a care plan? And we need to understand all the different variables so we can really personalize and not cast off if somebody is making decisions. Maybe they want to integrate different dietary restrictions into their care because it's important to them in their beliefs. Like, I hear too often from patients that things like that, because of, cultural background, that there are certain foods that they eat or don't eat. And people say, well, you can't do that. Just take this medication. Well, that's not being very sensitive, is it?
No.
And so one of the things that I hate most in how we talk about these different things is the term non-compliance, because it puts the onus on the patient as if they don't want to follow their care plan.
Right.
They just have other things that are important to them, or what you're just talking about around the fact that these different things are designed in silos. And then we just thrust it all, at the patient and be like, do it, just take care of yourself. And you're like, well, this app doesn't talk to this app. I can't get my records downloaded from here, so I can't go to my other specialist that needs these records. And you're telling me I now need a fax machine to get them. And now I can't make that appointment that I waited 6 months for. It's bananas how hard it is to just try to follow your care plan. And so that's why we need to get input from a lot of different patients, a lot of different perspectives and experiences, so that you can create a more seamless care process for the patients and for the other stakeholders involved.
Mm-hmm. That's absolutely right, because I think so much of medicine is generalized. And, there's a specific person sitting in front of that provider, that healthcare provider. And, I do think that you were saying it's the macro stuff, it's socioeconomics, it's education, it's belief systems, and then it's just individual preferences, individual ways of learning. These are real. And they have to be taken into consideration. So important.
Yeah. Well, I think, to kind of come back to some of the conversation earlier around technology and how a lot of this came to be. I mean, first of all, patients have been asking for telehealth for years. So this is something that's like, when other people in positions of privilege have a challenge, then voila, it gets rolled out. But so many people who may have, limited mobility, don't have access to transportation, or just are busy, they wanted access to this kind of technology before. Now, it doesn't mean it's one size fits all. We rolled out telehealth so fast and didn't understand, of course, different sort of the digital divide and who maybe have access. But think about how all three of us right now, we are in a safe space that we are comfortable sharing with other people.
Right.
We are comfortable with our voices potentially being heard by other people within earshot. We hear from patients that say, my cancer recurred and I haven't told my kids yet. So I'm taking this telehealth visit from my car, which I'd rather have gone into the office, but, needing to understand these kinds of things. And people who also maybe, many people living in a small space and they're uncomfortable sharing what is behind them. So all of these different things factor in to make sure that we're understanding not just the personalization from, as you were mentioning before, the different experiences, macro aspects of it. But what's your preference? We want to be able to tailor that accordingly.
Right.
Yeah. So it's really so important. So do you have some examples of companies or organizations that are co-creating and designing with patients and caregivers that what does good look like?
Yeah. Well, while I can't share all the details, we certainly have case studies with many companies that I'm excited to be able to share that, patient input has directly gone into making these changes. and certainly names that you would recognize, like Amazon came to us wanting to make sure that their Alexa devices were able to understand people with stutters and stammers better, so that, it wasn't an accessibility issue. And so therefore we were able to bring together people who live with stutters and stammers to interact with and give feedback on the product. And ultimately that resulted in creating a new feature that Amazon rolled out. It's amazing that people gave that perspective to do that. And then we have folks like AstraZeneca, who we've done a lot of work with to make their clinical trial experience better for patients. There's sort of a new wave of things called decentralized clinical trials. What that means is that a patient may not have to go into, say, like an academic site. They might be able to participate largely in a clinical trial from home. But what kind of support do patients need when doing that? So how can we think about the whole process from end to end? So patients were giving iterative feedback on what that process would be like, so that they're ultimately feeling more supported in the end. So we applaud and are so grateful for the companies that are doing the work earlier up front, rather than deploying something and going, oops, that didn't work, and it's too late to fix it, and those patients will figure it out. Like really making sure that they're getting feedback early and often.
That's amazing. It's good that we're hearing that companies are really thinking about this. We're never going to get 100% of this right, but we can all do better. So, I'm sorry. Go ahead.
We think of patient engagement more as a verb than a noun, and I mean that in the sense that it's not just a one-time thing. And when companies come to us and say, "Oh, what's the perfect way to get patient feedback?" Well, there isn't. And so the perfect thing is just to do it and do it again and do it again and do it again. And so it shouldn't be a one and done.
Right. So are there any special projects that are happening that you could share with us, or anything new that's happening at the cooperative?
Yeah, so there's, always new opportunities that are coming online, constantly. Every week we deploy them. We're really trying to also get more feedback from our community to understand, how else can we be partnering with organizations? And so therefore, if you are part of, it doesn't even have to be an official advocacy organization, but if you lead a Facebook group, or you're connected to a community-based organization and you want to have more opportunities to get involved, but also bring more people into these kind of conversations, we want to partner with you. And just like I said, that we care about making sure that patients are fairly compensated for providing their expertise in something like an interview or a survey, we also work with our partners in the same way. Because as a patient who has built out a patient community too, we know how valuable that is. So we really take care of our partners to make sure that they feel supported, are also, very aware of all the happenings here at Savvy Cooperative. So we welcome more people who are interested in getting more involved to give us a shout. You can always reach us hello@savvy.coop. And we would love to talk to you about, partnerships and ways that we can also amplify the work that they're doing. For us at Savvy, because we are disease agnostic, we don't do what you would think of as, traditional patient advocacy around programming and policy and education in disease areas. But it doesn't mean that that's not important. And so we want to help amplify the work that our partners are doing, so that our members know, okay, if you do have MS, like, here's the resources we can direct you to. So we're really excited to build out more of that infrastructure.
So, Jen, what do you feel has been the overall impact of, what the cooperative has done?
I think we have been able to take this notion of asking patients and make it much more mainstream and unforgettable, I guess you could say too, that we've been able to have enough impact that people go, oh yeah, we've heard of Savvy. We know that we should be asking patients. We see that hashtag around. And so it's putting a little bit more pressure on companies to actually do the work. And so also very proud of all the work that we've done around diversity, equity, and inclusion, and making sure we're bringing in new and diverse voices who haven't ever had part in these kinds of conversations before. And so I think that through that kind of work and going out and speaking at professional conferences and sharing this message, it's allowed for more and more opportunities to come in. And so really excited about how we can offer those to more people going forward.
That's great. And just something you were saying earlier about, savvy, I think of it in hearing you speak as a bridge between the, specific advocacy organizations that are looking specifically at, diseases or conditions. And, what you guys are doing is very specific, and being able to allow patients and caregivers to have that voice and to connect those dots, I think is incredibly important for just the industry as a whole.
Yeah, that's really kind of what we're here to do. This is the one thing that we do, is to help to sort of play matchmaker for these opportunities. And so we're really excited to be able to support, those people that are also doing other work. But we take sort of the administrative burden out of doing that because we have the infrastructure to do it.
That's awesome. So in the last few minutes that we have, is there anything, a little peek behind the curtain, any future fun thing that you can let our audience know about?
Oh gosh, I should have come prepared with more fun things. I think, again, we really want to start doing more with the community. And so that can be, we've talked about different types of patient events and things that can help bring things more locally too. And so we're working on some stuff in that regard, so that it's not just talking with, other innovators, but bringing communities together. But again, since we're disease agnostic, it's not around any type of policy or, program for people with diabetes. But, through our partnerships, we might be able to offer some of that and also help, raise awareness for different organizations. So stay tuned on those things.
So great. So how can our audience get involved? Jen, how can they get involved?
Like I mentioned, you can certainly sign up to receive our weekly newsletters. That's a direct way for you to understand the different projects that we have. Again, that is savvy, savvy.coop. And you can also then, of course, follow us on social media. Our handle for everything is savvy_coop. And so you can follow us on Instagram and Facebook and Twitter, and we share those opportunities out there as well. So if you forget to sign up for the newsletter, you can follow us on social, and hopefully we'll be able to get you involved sharing your story very soon.
Well, Jen, thank you so much for sharing your story about Savvy Cooperative, and also gives me a lot of hope that patient advocacy, patient engagement, putting the patient at the front and the center of the healthcare conversation, that we are making, some really good progress. We're really appreciative of those who joined us live. This will be taped on our YouTube channel, and Jen, we've been putting out all of your info and tags along the way, so that's captured in the video. And we really appreciate you coming, to be with us today.
Oh, well, it's my pleasure. Thank you for the work that you do to help share these different ways that people can use their own story, their own voice, or that of their, family members that they're caring for, to make a positive change. And so if we can be a part of that in somebody else's life, we're very excited to do so. So thank you for this opportunity.
Great. Everyone have a great weekend, because we're there, and we look forward to chatting again in the next couple weeks. Bye, everyone.
Bye.